Okay, everybody, we're going to start the meeting right now. Welcome everyone to our fifth and last webinar of the series for the National Hispanic Hepatitis Awareness Day 2018. Before we start the webinar, we have some housekeeping rules. I have muted everybody online so we don't get interrupted by the background noise. If you have questions or comments during the presentation, please share them with us in the chat box function on the platform so we can answer or address them during the questions and answer section at the end of the webinar. Also, this meeting is being recorded. Again, welcome everyone, and thank you for joining us this afternoon for our webinar about OMHRC efforts around hepatitis C among Hispanic and Latinos. My name is Luis Mares, and I am the Director of Community Mobilization Programs at the Latino Commission in New York City. Our presenter today is Diana Echenique, Master's in Public Health, who is the Senior Program Analyst for the Capacity Building Hispanic Latino Program at the Office of Minority Health Resource Center. Our webinar today has three objectives, which will be shown in the following slides. Showcase OMHRC efforts to increase HIV and viral hepatitis C screenings among Hispanics through recent social marketing campaigns. Explain the content and format of training curriculum to educate community health workers serving Hispanic, Latino, Spanish-speaking communities currently under development, and to strengthen collaborating efforts among organizations and agencies to contribute to increase clinical adherence, screening guidelines, treatment, and management for vulnerable populations in the United States. So thank you, Diana, very much for being here today to share such important information with us. The floor is all yours.
Thank you very much, Luis, and good afternoon for everyone. On behalf of the Office of Minority Health, I will be speaking during this webinar. When the Office of Minority Health was created, its legislation supported the creation of the National Minority Health Resource Center to carry out the following. The Office of Minority Health Resource Center facilitates the exchange of information regarding matters relating to health information and health promotion, prevention, health services, and education in the appropriate use of healthcare.
Diana, I'm sorry to interrupt you. I have messages here that it's hard for them to listen. Could you please get closer to the phone? Sorry.
Is this better?
Much better.
Oh, thank you. So I was saying that, and telling you a little bit about the Office of Minority Health. And so one of the other resources or services that the Office of Minority Health provide is to facilitate access to such information in relation to minority populations in the U.S., assist in the analysis of issues and problems regarding health problems, provide technical assistance with respect to the exchange of information, including facilitating development of materials for technical assistance. When the Office of Minority Health was created, in legislation supported the creation of the National Minority Health Resource Center. This is just a brief information regarding the dates and such. More specifically about the departments within the Office of Minority Health Resource Center, we have four blocks of services. One of them is Knowledge Center, which is a collection, management, reference services, research, support, and training. The Capacity Building Organization, Capacity Building Services, Technical Assistance and Capacity Development Services for Minority Serving Organizations, the Communications, Marketing, Outreach, Media Relations, Social Media, and Graphic Design, Information Services, Inquiry Response, Information Dissemination, Exhibits, and Program Support, and the Information Technology, Website Development and Maintenance section, and compliance with file 2008. Now I would like to share some information about the global hepatitis C virus strategy. According to the World Health Organization, this is the first global health sector strategy on viral hepatitis, a strategy that contributes to the achievement of the 2030 Agenda of Sustainable Development. Viral hepatitis is an international public health challenge comparable to other major communicable diseases, including HIV, tuberculosis, and malaria. Despite the significant burden it places on communities and health systems across all global regions, hepatitis has been largely ignored as a health and development priority until recent years. The viral hepatitis pandemic is responsible for an estimated 1.4 million deaths per year from acute infection and hepatitis-related liver cancer and cirrhosis, a toll comparable to that of HIV and tuberculosis. Of those deaths, approximately 48% are attributable to hepatitis C virus. Virus hepatitis is also a growing cause of mortality among people living with HIV. Among about 2.9 million people living with HIV are co-infected with hepatitis C virus. An effective response to fighting hepatitis C virus requires a range of common actions, while at the same time delivering tailored interventions for each of the viruses and populations affected. A little bit about people who inject drugs and hepatitis C virus. Viral hepatitis C is a blood-borne infection with significant transmission occurring in early life and through unsafe injections and medical procedures, and less commonly through sexual contact. People who inject drugs are at high risk of hepatitis C infection because of the share of contaminated injecting equipment and blood. Hepatitis C virus epidemic related to injecting drug use occur in the United States with an estimated of 3.5 million people who inject drugs having been infected with the virus, hepatitis C. So a comprehensive prevention strategies for hepatitis C virus should include assurance of safe blood products, safe injection practices, harm reduction services for people who inject drugs, and of course, promotion of safe sex. About studies in the United States, we have the U.S. Cascade of Care study published in 2014, which was funded by NIH. The purpose of the study was to identify gaps in care for people with chronic hepatitis C virus infection, which is important for clinicians, for public health officials, and federal agencies. The objective, another objective of the study was to review the literature to provide estimates of the proportion of the chronic HCV infected persons in the United States. Part of the the study identified large gaps between current practices and treatment goals for people with chronic HCV infection And it also highlighted multiple opportunities for providing engagement, particularly in the diagnosis and awareness of infection, prescription of antiviral therapy, and achievement of sustained virologic response, or as most known SVR, better known. So more specifically, barriers to achieving hepatitis C cure. Despite the availability of highly effective therapy for hepatitis C virus infection, few patients receive treatment. Barriers are at multiple levels, from providers in health system and health insurance, at the patient level, as well as the government and payer level, a lack of promotion and surveillance as well. Each of these barriers need to be addressed if wider implementation of antiviral therapy is to be achieved. Barriers between the disease, HCV, and being diagnosed. For instance, we have asymptomatic, the disease is asymptomatic, poor awareness and education, especially that is tailored to specific populations, lack of medical coverage, and physicians' failure to screen and test. These are just some of the barriers that people face, people with HIV and drug users and co-infected with Hep C face. Of course, stigma, lack of access, as I mentioned before, phobia to the disease, of course, also another problem is when once being diagnosed or tested and is a positive result for HCV, the referral system becomes a barrier. Non-adherence to the treatment, failure from the health providers to identify timely, and this becomes an impediment for delivering of the hepatitis C care. The need of referrals also is a barrier, and not in a timely fashion for some of the populations. Logistical concerns, such as transportation or the system in place of providing the referrals, depending also on the insurance of the carrier of the patient. Limitations on specifications of explaining what is the process on the treatment as well, and availability of the treatment within the geographic area where the patients are located. The barriers to the treatment becomes patient fear and misunderstanding of the treatment and the disease itself, stigmatization, as I mentioned before, substance abuse also. Those are people who use injectable drug use, psychiatric comorbidity as well, financial concerns, transportation, logistical concerns of the long term of the treatment, communication difficulties such as limited English proficiency is another barrier to the treatment and patients. With in the Hispanic community, health study soul is known as the study of Latino soul. This study and the data collected through the study has provided an opportunity to have more specification about specific data with regards to Hispanic. A little bit about the study. This is a multi-center epidemiologic study in Hispanic or Latino populations. It used two type of databases to come up with information that is presented here. About 16,000 Hispanics participated in the study between the ages of 18 and 74 years at the time of the study, and it represented all the groups, or at least the major groups of Hispanic Latinos in the U.S., Puerto Ricans, Mexicans, Dominicans, Central Americans, South American, and Cubans. With this population in mind, a study was, an analysis was conducted by the Albert Einstein College of Medicine in the Bronx, in New York, and the analysis identified that the group that is the most at risk of all Hispanics in the U.S. are Puerto Ricans, and of those, 3.9% of those more at risk are women. This is in contradiction to years before, where the lack of a specific data on Latinos in the U.S., because of the lack of data in a specific studies of the Hispanic Latinos in the U.S., it was believed that Mexicans were the highest at-risk group of Latinos in the U.S. Sorry. Sorry. Now, with regards to Hispanics, my apologies, are 60% more likely to die from virus hepatitis than whites, and despite having lower rates of hepatitis, Hispanics were 50% more likely to die from this disease in 2015, according to several studies. So, what is the Office of Minority Health Research Center doing? What is our efforts to prevent viral hepatitis C among Hispanic Latinos? The efforts include written successful proposals aimed at reducing the impact of HIV and AIDS in racial and ethnic minorities, external presentations at United States Coalition on AIDS, American Public Health Association, the Latino Commission on AIDS, as well, exhibiting at various conferences to support their efforts of these organizations on eradicating HCV, increasing screening, early detection, and improving access to care. We participate and support the activities of several organizations. We also, such as the Latino Commission on AIDS, also collaborating on webinars such as this one, with also presenting in collaboration with other experts and organizations as well. The Office of Minority Health since 2004 has successfully also written proposals aimed at reducing the impact of HIV and AIDS on racial and ethnic minorities. More specifically, we support the Secretary's Minority AIDS Initiative Fund projects, which one of the areas is on HIV and hepatitis project funded in the 2016, fiscal year 2016, to address comorbidities of HIV and AIDS and hepatitis in minority populations. 12 contracts were awarded to community-based organizations to create social marketing campaigns with goals to increase awareness of the co-infections and increase HIV testing and hepatitis screening with referral to care for hard-to-reach racial and ethnic minority communities. We had a specific projects as well for specific populations. Next slide. The Office of Minority Health also in 2015 funded 12 community-based organizations. The HIV and AIDS and hepatitis awareness, the organizations that were funded had as an objective to have the HIV and AIDS and hepatitis, increase awareness of hepatitis, and increase referrals, and also increase the support to the National HIV and AIDS strategy by increasing awareness and testing for the comorbidities of hepatitis and HIV in minority populations, as well as implement hepatitis specific strategies to target populations. Of those organizations that were funded in 2015, we have the Colorado Health Network in Denver, Colorado. We also funded the Family Health Centers of San Diego, in San Diego, California, and the Latino Commission on AIDS in New York. I want to share with you some of their materials that they developed. The Colorado Health Network in Denver had a multi-platform to reach MSM population through TV spots, through Facebook, print, bilingual materials. They also have Instagram and desktop strategies as well. We also had Family Health Centers of San Diego. Very creative ways to reach the MSN IDU population, as you can see. They also had several prints. And the Latino Commission on AIDS included the MSM, transgender women, and IDU, older men and women, people who are unaware that they may be living with HIV or co-infection, women and new undocumented immigrants with messaging in English, Spanish, and Portuguese materials. And they also launched this initiative, the National Latins AIDS Awareness Day, on AIDS Awareness Day, October 15. This has been a very popular initiative and very successful as well. They also have several materials with key information regarding the Hispanic and specific numbers on the population that is impacted by HIV, hepatitis C, and those also among drug users. The OMHRC efforts around viral hepatitis C among Hispanics also, we are currently developing a curriculum to educate community health workers serving Hispanic Latino populations. In this curriculum is in development and will be available in 2019. We also have materials and information statistics through our website. Sign up for updates also. We do outreach through social marketing as well, and we collaborate with several of organizations who work in this area and to support their efforts. Thank you.
Thank you, Diana. So we are going now to start the questions and answers. So if anybody have a question, please write it in the chat box so Diana can answer. Anybody? Questions? Julie Velasquez says representation, Diana. Okay, there's a question here. And how long has the social media campaign been going on?
It was funded in 2015, and participants last year did all the 3 organizations, or the 12 organizations, but out of those 12, 3 were specific to the Hispanic Latino, working with the Hispanic Latinos in the U.S. They did a whole presentation last year, and they continue to launch and nurture these interventions in their communities. So it is ongoing. Although the fund has stopped, they continue to support the strategies in their communities.
That is true. I had to add, I was in a meeting with Anna last year in the report, and though the funds have maybe not been, right now, we are still running the campaign, and we have social media going on about hepatitis and HIV. So James Moore asked if you have any information about Miami-Dade.
I don't have it in front of me, obviously, but as I mentioned, one of the resources that the Office of Minority Health Resource Center provides is information on health issues among minorities in the U.S. We can tailor the statistics, as we are one of the largest repository of health statistics on minorities. You can send us an email requesting specifications of the population, region, topic that you're looking for data for, and we can help you to find that information or provide you as much as we have in our databases.
Another question from Yuri is, why do you think Latinos are not as aware of hepatitis C treatment?
As I mentioned, some of the barriers are being unaware of being infected with Hep C. Lack of education awareness, again, of how they can become infected with hepatitis C. Drug users and those infected with HIV as well are not aware of the possibilities of becoming infected with hepatitis C. So awareness is a big issue. Once being diagnosed, the long-term, first having access to the treatment, and that includes social determinants of health, right? The location of where to have access to the care. Prior to that, being referred for appropriate testing, and then one being diagnosed to being referred for the treatment, and having appropriate transportation access to have access to the treatment. So as you see, are barriers upon barriers. So these are multiple layers, barriers that our population has to go through to be able to have access to the treatment, being diagnosed, and being successful, then ultimately to be cured. So different organizations, such as the Commission on AIDS, work on at different levels to try to remove these barriers. We try to work on other aspects, such as developing this curriculum for community health workers on hepatitis C and HIV and in Spanish, to try to arm community health workers with tools to educate our communities. So, in a long answer, multiple barriers that all of us in collaboration are trying to work to ameliorate the impact of those barriers for our population to have access to information, screening, and treatment.
And I think you partially responded to the next question. Marcos Sigala asked if there is any marketing material in Spanish.
Other materials, well, the Latino Commission on AIDS have various materials on the website in multiple languages. CDC has some, although those are more statistics related, as some of you saw. We specifically have we are working on this curriculum in Spanish. It's not a translation of something that was created in English. This has been an effort to create from the get-going a material in Spanish for community health workers to educate Hispanic Latinos in the U.S. So that is a very exciting initiative here at the office, the Minority Health Resource Center, and that is one specific, very specific material that we are working on with regards to this, to hepatitis C.
It's just great to know that something's being done from the get-go in Spanish. Usually it's all translated, but it's great news. Kevin Salazar asked if there any work being done in Boston, Massachusetts?
I am sure there is. If the question is if OMHRC is doing something specific in Boston, we are not. We don't have a funded initiative there from the Office of Minority Health Resource Center. That doesn't mean that there are not activities or interventions going on that are at the community level. But one way to find out what is going on in your area is to visit your website of the Department of Health. Also, CDC has some specifics about initiatives that they have funded geographically. Perhaps the Commission on AIDS have some information. Yes, so I specifically don't know of any specific organization or initiative taking place in Boston.
Yuri Velasquez makes some comments. Yeah, he says he lives in Fort Myers in Florida, and intravenous drug users are the main group affected or infected with hepatitis C, and why non-Hispanic are very well aware of treatment. Gilead has a great commercial for Harvoni, but he hasn't seen anything for Hispanic Latinos. What would you suggest to expand awareness in our community?
Well, one way is this is a multi-level approach. As you know, we have this epidemic of drug, opioids, and injectable drugs ongoing right now. We have different targets of age brackets of the population. So for each of those brackets of the population, we need a different approach. So for those that are more tuned to social media, we need then strategies to through those channels, and that includes having information in Spanish, having referral to links to where to send our communities to find more information, having also provide them with information to where to go to seek screening. That this is at the same level of interventions at the ground level through community health workers, for instance. So one effort that we are supporting at the Office of Minority Health Research Center. Another approach is to radio. We know that our population are very tuned to radio. They are, most of them, we are tuned to have the radio on. So having key messages, clear key messages to inform our population of, first, how we can get infected with viral hepatitis C. We know that this is a blood-borne virus, so that is important for our population to know. And how to get the testing is and where to go. So if we can put that information through radio spots, that is another form of getting this information out to inform our population. Also collaborating organizations on the ground. One organization alone cannot do it all. So collaborating on what efforts several organizations in our communities are joining efforts is also another way to maximize efforts and be more impactful and informing our communities.
Okay, and there's a question from Lindsay Lasso. She's asking, what are the current resources for hepatitis C virus treatment among undocumented patients?
Tough question. The treatment in itself is the same for anybody. It's not segmented by your immigration status or what part of the population we are. Having access to the treatment is a different question. Part of that has to do with, yes, an immigration status, because there are areas or clinics at the ground level that can provide access to the screening, referrals, and treatment. Having said that, some of the clinics are federal funded. They do not require to, as far as I know. It's not, those clinics are not asking for an ID or identifying what is your immigration status. But fear of our population going to those clinics is a barrier. Type of insurance that we carry also is a barrier because our insurance may not be as comprehensive, and so that poses a barrier. The health providers as well, having a timely referral for further screening and treatment is another barrier. So again, it's a very frustrating situation, but it's a multi-layer process of barriers. So again, from various angles, it's important that we work together and in collaboration to try to mitigate the impact of our population having lack of access to treatment for hepatitis C.
Judy says thank you. One last suggestion is to increase awareness within the local health departments during immunization campaigns. All vaccinations are important, specifically hepatitis A and B, and suggest Hep C testing. Also, if you are at risk for Hep C and for baby boomers, lastly, provide resources for Hep C treatment in the community. There's another comment here from Alan Small. He says they have seen young adults or pediatric patients who were not considered for hepatitis profile, as it was assumed that since they had hepatitis B vaccine or the cost of additional labs, that they were okay. Any other questions for Diana in the floor? It seems there's no more questions, Diana. I just want to thank you very much for your support, your help in this webinar with the Latino Commission and AIDS. There is the contact information for the Office of Minority Health. If you have any questions, you can write to the email over there, or you can go to the website and look for the information you want to see. Once again, thank you very much, Diana.
Thank you for this opportunity.
And thank you, everybody. This is our last webinar for NHAD this year. We will start soon with NLAT webinars, so I hope to see you there too. Thank you, everybody. Goodbye.